In the second section of our lecture, now we will talk about the development of different fetal organs. In this section, we will talk about the development of kidneys, gastrointestinal tract, liver, pancreas, and gallbladder. The kidneys, this is the ultrasound of the, this is the chest tray and the kidneys. So this is the ultrasound appearance of the fetal kidneys. The renal corpuscles formed at about 22-week gestation. Then there is formation of the kidney around 36 weeks gestation. So kidneys are developing very late in the gestational age. Then glomerular filtration increases towards term as the number of glomeruli increases and fetal blood pressure rises. So this is glomerular filtration. As the number of glomeruli increase in the kidneys or in the tubules, then they start forming the glomerular filtrate and start filtering the liquid, so fluid. This is the time when around 36-week gestation. So glomerular filtration increases towards term as the number of glomeruli increases and fetal blood pressure rises. Then the fetal renal tubules are capable of active transport. So fetal renal tubules are formed, and they are responsible for active transport at the end of the term also. So kidneys are the structures which are formed at the end of the gestational age. Corpuscles develop at 22 weeks gestation, and then formation of the kidneys, and slowly its function start after 36 weeks of gestation. Fetal urine is in the amniotic fluid. So fetus swallow and secrete the urine in the amniotic fluid. Now the formation of gastrointestinal tract, development of the fetal gut and gut function is present throughout the pregnancy. So if you see by about 6 weeks gestation, first stage of the gastrointestinal development is at about 6 weeks gestation. So very, very early, we said at 4 to 5 weeks, the cardiovascular system is forming and heartbeat is present. So after that, the GIT is the other system that start forming early in the gestational period. So at about 6 weeks gestation, there is a formation of the gut. Digestive enzymes are produced, enzymes that are responsible for the digestion process later on is formed at about 26-week gestation. Then meconium. What's meconium? Meconium is the form of fetal feces and digestion of cells and protein in amniotic fluid. So meconium is fetal feces, and it causes digestion of cells and protein present in the amniotic fluid. So here if you see, this is the upper atretic pouch of esophagus. Then we have the fistula. This 6 weeks gestation, there is beginning of the formation of the gut. And then at 8 weeks gestation, it's prolonging bigger and bigger, and then the stomach is starting forming at the top. Here at about 9 weeks gestation, more stomach intestines are getting bigger and bigger, and then slowly the cord disappear. So, and then there is in the third stage at about 11 weeks gestation, there is stomach and there is small intestine and large intestine present, and about 12 weeks. So by the end of first trimester, which is the 12 weeks, first 3 months, the development of gastrointestinal tract is complete. Here first stage 6 weeks, then second stage 8 weeks, then 9 weeks, and then third stage is the cord disappear from where the intestines start forming. It gets bigger and bigger, small stomach is formed, and then there is small intestine and large intestine formed. Then the formation of liver, pancreas, and gallbladder. So first, in the first stage here, if you see this diagram first, in the first stage, at the 7th phase or stage of the pregnancy, the endoderm formation occurs. There are 3 layers from where all these structures and embryos is formed. We have endoderm, we have ectoderm, and then mesoderm. Endoderm is the innermost layer, mesoderm is the middle layer, and ectoderm is the outer layer from which the skin and appendages are formed. So endoderm is the layer from which the liver, pancreas, gallbladder, these are all formed. So first, at the 7th phase of pregnancy, the endoderm formation is taking place. This is the endoderm, and then this is there is hepatic specification in the 8th phase of pregnancy, and this is endoderm is divided into foregut, midgut, and then we have hindgut. Foregut, the front of the gut, middle, and then the hindgut or the back of the gut. Here, this is hepatic specification. If you see, this small part is the hepatic specification developed in this 8th level of pregnancy. Then in the 9th level, there is liver diverticulum is produced. Liver diverticulum, and then liver bud growth occur. Liver bud is produced, and then there is hepatic maturation takes place. So all these structures, liver, pancreas, and gallbladder, pancreas, liver, and epithelial lining derive from the foregut. So this foregut give rise to liver, gallbladder, and pancreas. Fetal liver perform hematopoiesis by 6 weeks. So very early, liver bud is produced, and the function of the liver is to produce the blood cells, hematopoiesis, formation of blood by 6 weeks. Larger portion of diverticulum give rise to parenchymal cells. Then unconjugated bilirubin from the breakdown of hemoglobin is transferred from fetus to mother. Small portion of being in the liver and secreted in the bile. So the function of the liver is to produce the blood cells. As a result of the destruction of the blood or hemoglobin, there is production of bilirubin. And this bilirubin is unconjugated transfer from fetus to mother. That's why some babies are born when they prematurely they have yellow discoloration because of increased bilirubin level in their blood. So this is the formation of liver, pancreas, and gallbladder. Glycogen is stored also in the liver from the first trimester. So liver is forming lot of function, hematopoiesis, storage of glycogen, unconjugated bilirubin is transferred from fetus to the mother, and also small portion is secreted from the liver and being in the liver and secreted in the bile. And pancreas, liver, and gallbladder, they are produced from the endoderm, innermost layer of the foregut, front of the gut. So foregut here, you can see this is the beginning of the liver, and then the pancreas, and then gallbladder is attached to the liver. So that was all about the formation of liver, pancreas, gastrointestinal tract. And thank you for watching sqadia.com.